That's interesting.
Especially in the rehab services that I've worked at, the amount of time taken up doing voluntary surveys of the client base is taking away from the core business far too much. And while you're not allowed to make these surveys compulsory because then they won't be valid, you can, however, offer free pizza if you fill out the survey. Now, if the quality of the response to any survey depends upon the quality of the afternoon tea you provided, people who are demanding these surveys don't understand the landscape of the industry we're working in. So the validity of a lot of the results we get, I would truly question.
Do you think in that sort of basis, what people doing these programs are having to do to satisfy the funding bodies is out of sync with the actual results of some of these programs for the consumers and the people delivering them?
Some services end up, via these surveys, having a reflection of supposedly getting poor results. However, they can be the very programs and services who are not cherry-picking their clients, who are taking on the really hard cases where the results are always going to be somewhat less than, say, an employment service who takes on highly employable people. So you're getting slanted results because you're not looking at the questions in the first place and who you're asking the questions of. An employment service that takes on the unemployable, as some people are unfortunately called, are never going to get high outcomes. But those people still have a right to service, and I don't believe that the bean counters should deprive them of that right simply because the outcomes are not meeting a certain standard. Same can be said for outreach services. Outreach services have got an emphasis on rehab these days. They used to be called support services, where it was a case of the outcome was to keep people out of hospital, which is a valid outcome. Now, of course, the outcome is to get people through the service, exit the service, eventually move back into the mainstream community and potentially employment, get them off welfare. Some of these are unrealistic. You're saving money by keeping people out of hospital, and that's measurable without a survey. You've got stats for that sort of thing. So if the client base from an outreach service is not being hospitalised regularly, that's enough to know they're doing their job. You don't need to survey the actual consumers to find out.